Hello, Elaine. I'm so
Hi.
glad that we get to talk today. And I really want to share with others just how much you've helped me. And I know many others in this life dealing with fibromyalgia. I don't know if you remember, but when I first was diagnosed with fibromyalgia in November of 2018. I had no clue what it was. And so I started researching and I stumbled upon videos with Dr. Geneva Lipton, and you were on there and you were talking about just how to, use meditation and, some of the breathing techniques, and all of that was brand new to me. I had never even thought about meditating before. And things like that. And so anyhow, and then we kind of connected via LinkedIn, and now we have a chance to do a couple of projects together. And I've been blessed to be in your support circle for, is it 2 years now?
I think it
almost.
is just about, yeah.
Yeah. So, and I've learned a lot from you, and you know what, probably not just learning things from you, but just your encouragement. You're always, letting me know that I'm, doing okay. And that makes me feel better.
Good.
I appreciate you very much. So I want
Thank
to, in this conversation, have you share a little bit more about your background and what you're doing now. And so I know that you started approximately 20 years or more ago with support groups in general. Can you tell us a little bit of how that all started?
Yeah. It's kind of amazing me. It's been that long because it was just, it's like every day and year at a time.
Yeah.
But it started really, I was kind of a gift for me about a year before the auto accident. And then, a year and a half after that, I was diagnosed with fibro, and that was in 1989. So in 87, I did, I think it was about a 3-month training program to be a biofeedback practitioner. Somebody had led me to this woman that she said, she was a nurse in private practice, and she said, you two have a lot, in common. And she knew I was really interested in stress and helping people with stress management at that time. I was a nurse at the time. And so I met Sue and I did the training program with her, but it really wasn't what I wanted to do. I learned a lot about stress and relaxation techniques and all of that, but it wasn't really what I wanted to do as a private practice. But we stayed in touch. And then later that summer, she contacted me and she said, I think you would really be good in doing groups. And I have some of my women patients that I think would benefit from being in a small group together. I think it would really help them. So that's how I got started. It was just kind of happen. It wasn't something I was looking for, but I loved it. And from the very beginning, I just saw how it really, because I had done some teaching and that types of things with groups in my healthcare background before, but not a support group type thing. Uh-huh. And I just saw how the bonding happened, when they came with some common challenges that they were having in life, and what that did for them.
Mm-hmm. I've experienced that in our own group that we have right now, and how we've bonded so so deeply.
And the courage was another thing. I saw that because different people are at different places, in mm-hmm. relation to what the challenges in their life. But when somebody's ready to take, more steps than some of the others in moving forward or trying something new, it gives so much courage to the others. That's what mm-hmm. I saw. It wasn't me trying to talk them into trying this or whatever. Mm-hmm. It was that shared experience and them seeing somebody else taking the step. And then I think the process, well, maybe I can try doing something different too. Uh-huh. I saw that as a really powerful thing.
Boy, you just said 1987 that you started out with biofeedback. I mean, that was well before. I mean, to me, that's still even kind of a new thing right now,
Well, so it kind of was in vogue. It was kind of in vogue then, and then went out of vogue because insurance stopped reimbursing for it.
Oh.
And I think, yeah. Oh, so it's kind of come in and out of being in vogue.
Yeah.
And then when I started doing the groups with fibro people, then so the year after the biofeedback training, in 88, I was in an auto accident, and 18 months after that, then I was diagnosed with fibromyalgia myself. And the first 4 years, I just went into denial because I'd had excellent health before these injuries. And I just thought, as a nurse, I was just going to find the answer to all of this.
Fix it, right? Yeah.
Yeah, exactly.
I think we all kind of think that in the beginning, right?
Yeah. So I went for about 4 or 5 years really in denial, just trying to push my body to respond and to do what I'd always done in the past. And it, obviously it didn't work very well. And I was just really getting to the point of struggle and also feeling like I was moving into depression because I was just spending my weekends recuperating from my work time during the week. My social life was falling apart, et cetera. So that's when I started educating. I thought I have to make some changes. So I started changing my lifestyle, changed my work, left nursing, and focused on just really experimenting with what I could do as far as my lifestyle to feel better and get some quality of life, because I'd basically lost my quality of life. And so during that time, I started, looking for places of information. There wasn't a lot written yet, but I found out, I lived in Portland, Oregon at the time, that at the Oregon Health Sciences University Medical School Hospital, they had a very active fibromyalgia research team at the time.
Wow, that's amazing.
I know. I mean, I was fortunate. Yeah. So I started going there every year and a half. They'd have a conference open to the public to discuss their research and what they were recommending at that point. So that's where I got a lot of my information. And so within about 5 years, then I was feeling like I could go back and do some kind of health care work because I'd stabilized enough. I mean, I still had a long journey ahead, but I stabilized enough. So I thought, well, I'll put together a class. I'll put together a 4-week class and just contact the health education centers with the medical centers in the city to see if somebody was interested. Well, one of them was. And so I got started teaching there a 4-week class I called Living Well with Fibromyalgia in September of 2000.
Okay.
And then the next year started running their support group. And
And that was in person, right?
That was in person. Yeah, I miss the in person. Yeah.
Yeah.
That was in person.
Well, I'm thankful in some respects that you had to go virtual because, you're in Oregon, I'm in Michigan. I couldn't be a part of it if you didn't do it virtually. So that's neat that you've done that.
And I love meeting people from different parts. I've had people from outside the country too in groups, and I love that part. I do miss the in-person, just feeling that energy in the room. But yeah, there's pluses to the virtual also. So
you said that along with what you share, which I know that I've learned a lot of just kind of calming and reflection and those kinds of things from you, that you see that the members kind of come together and help each other out. Are there other things that you've noticed within this kind of structure for helping people better live their lives when dealing with chronic illness?
Yeah, it's the general sharing of resources. And it's not, because different people tried to, there's all the modalities and, there's so much experimentation and exploration that we need to do generally and finding out what's going to work for us. And so having that round table of people to draw from the experiences they've had in trying different modalities, it's not just all coming from me. I mean, I haven't tried everything. That is really important, is the sharing of resources. And other than that, the other thing I would say is the sharing of internal resources. And this is my take on it, as all of us develop different strengths, what I call internal resources, depending upon the life experiences we've gone through. And some are stronger in some people than others. And that gets shared in that sharing of people too, which is incredibly important. I couldn't give it all to them. It's not all in me. But I want to interject something now too. I first called these support groups when I first started doing them.
Okay,
that's
sure.
Called it that at that time. And we sat at, it was a health education center in the classroom. We sat at these long conference room tables. I was the head of the table, and then either in my classes or my groups were, around the edges. Well, when I started later, after I retired from health education in 2010, and then learned about Dr. Lipton in 2012, and then made contact with her and was invited to teach there periodically when I wanted. And we, at her clinic, the rooms were smaller, and we sat at round tables.
Mm.
The groups were small, and we sat at round tables, and I loved that feeling of that there was equality. There was a sense of equality around the table,
Mm-hmm.
and just that round. So I started calling them support circles.
Yeah. I think that gives a different mindset. I know,
It does
I
to
noticed
me.
that for myself. Yeah. That we
It does to
all
me.
share within the circle. And yeah, you kind of guide the time together, but yet, you know, we're all kind of contributing. So that's pretty cool.
Right, right.
So obviously you've had to adjust from being in person like that to now, you know, you mostly do virtually.
Do all of
What
it
else,
virtually.
yeah, what other things have evolved over time? I mean, over 20
Oh,
years.
yeah. Well, over time, my focus, because really I was thinking about this and preparing to talk with you today, that, you know, when I track it back from 2000 to now, really the focus or a lot of the messages that I bring to share with people in the circle are from things that I've studied or things from my own experiences. That has changed over time
Oh,
because
yeah.
my journey doesn't stay at the same place. That
Yeah.
evolves over time. So early on, it was all about helping with people just feel validated. I mean, that was one of my initial intentions and for starting to teach classes for people with fibro and the support was just to validate their experience and to reduce their isolation. Because
Well,
I
because that
remember,
was such a huge thing. I mean, I think it's still a huge thing, but maybe a little bit less so, at least in my
yeah,
own experience. You know, that I guess there's a little more knowledge than, let's say, back in the 80s and early 90s and such. But yeah, to actually have somebody say, yeah, fibro is a thing.
it's real. It's
Yeah.
real. Yeah. So that was kind of my original intention because I had struggled so with that. I mean, even some of my healthcare friends, nurse
Mm-hmm.
friends, didn't understand and didn't really have a lot of compassion. I mean, it's hard for us to come to terms, and it's hard for other people when it's outside their experience. So that was one of my first intentions, and to bring information to them. So that's what I would do. I'd bring the information from attending those sessions at university, hospital, and I also you know, I lived in Portland, Oregon. We have an abundance of complementary practitioners here because we have
Mm-hmm.
a chiropractic school, a naturopathic school, and an acupuncture Chinese medicine school. So there's a lot of those practitioners. And I didn't have a lot of finances to go to a lot of alternative practitioners, but I was real interested in a variety of approaches. So I would go at that point in time. I'm not sure if they're still doing it. Some of the natural food stores used to have speakers from those complementary medicine practitioners come in and do sessions in the evening once or twice a week on their particular modality. So
Mm-hmm.
I went to those a lot for several years, and then I would bring the information from that back to people too.
Uh-huh.
And then in my support groups, I would have different guest speakers in, a physical therapist that worked at the hospital where I was teaching in health education. She also had a yoga studio. So she'd come in and do a, simple chair yoga
Mm-hmm.
example for them. And I had a Qigong instructor that came in and did it.
Wow.
Yeah, I had an
Again,
acupuncturist.
way before your time or whatever,
And then an acupuncturist that came in just to tell people about it and
Uh-huh.
share what the needles look like, because that was something that was helpful for me at one phase of my journey. For about 2.5, I went to the acupuncture school, which was reduced fee, and would have treatments on a regular basis. A naturopath that had an office near to the health education center. I would invite her, and she'd usually come a couple times a year to share her information. I'd have people like that. And so it was mainly just to expose people to a lot of pathways and, different approaches to this, and also to bring up information from the university research. So that was kind of initially.
Mm-hmm.
And then I got introduced to mindfulness.
Mm-hmm.
And somebody in one of my classes, one of my fibromyalgia class, one of the participants, she said to me one day, do you know that book, Folk It Has to Be Living by John Kabat-Zinn? And this was about 2 years after the book had come out. And it was about the third time somebody had mentioned the title, but I hadn't looked at it yet. And she said, because you kind of have some similar thoughts about mind body as he does. So I said, well, I'm going to have to read that. I did. And it was all about his mindfulness program, his mindfulness-based stress reduction program. So I set away it was a set of cassette tapes in those days. It was like 5 or 6 cassette tapes, and started working with those of myself. And for me, it was just a natural connection for me. I know it isn't for everybody, but for me, it was a big change maker. And I feel like it's one of the foundational pieces in my progress with fibromyalgia over the years. So I started incorporating a lot more of mind body stuff in my classes. And then now I feel like I'm at a new phase. Since 2018, I've been taking classes around creativity and intuition, because that's a strong interest of mine, and I have time for it in my life now. And this new offering that I want to introduce, and hopefully getting it started in February of 2023, is all around giving attention to what our heart wants, what our heart and our spirit and our soul wants to express. So I feel like, I've worked a lot of attention around, attending to the needs of the body, attending to the needs of the mind and the mind body. And now I feel like it's a piece that I don't see a lot of in healthcare. And I think it's part of healthcare, and it's part of health well-being, is the spirit part, taking part of our spirit, especially when we're dealing with a chronic challenge in our lives, a chronic health, it's like, it's real easy to get dispirited.
Right. And totally focus on the body and that kind of thing, the pain, and even the, feelings, the depression or whatever else.
Sure.
And forget about having fun or being creative or having a passion for something else.
Exactly. And when we get in touch, my concept, and when we get in touch with expressing our creativity, we're expressing our wholeness. That's bringing us back in touch with our wholeness, our innate imagination and ability to create. That's not affected by fibromyalgia. It gets put on the back burner because there's so much grabbing our attention on the front burner. So how the changes I'm making in my support circles going forward is to give people that break on a monthly basis to come together and focus on the inside of what wants to be expressed and where their joy is and where their creative imagination is. And so I've got several ideas around helping them do that.
Oh man, that sounds great. And I'm looking forward to participating. I hope so. So if people want to learn more about this, how can they contact you?
Well, my email is eemerryfield@gmail.com.
Okay,
And
we'll
also,
make sure to put that in the messages and in your booth and different places so people can find that.
Good. And I do have a booth here in the virtual conference, and there's more information there, and my link there, if you forget my link to contact me. And I'm happy to answer any questions that anybody might have. Kind of my goal at this point, because we have the holidays coming and everything, and then January to recoup, is to start this new circle early February. And we'll meet once a month. And I'm happy to give out information and answer any questions for anybody that's interested. I'm going to kind of keep the number limited in the first go around, but yeah, just let me know if you're interested at all. And once we get past the holidays, if you're connected to my Facebook page or anything, you'll see a lot more postings around it too.
All right. Well, this sounds wonderful. And thank you so much for taking time to talk to us about it. And I look forward to learning more about it and hopefully participating.
Thank you so much, Katie.
All right. We'll talk to you later.
Okay. Bye-bye.
Bye.
Okay. So I just wanted to share a poem with you. I did the conversation with Katie Clark around my work over the years since 2000 and with support groups, support circles. And there's a poem that I forgot to read there that I want to share with you that to me describes what support circles around. It's called Tell Me She Said, and it's in a book of poetry called Pick and Clean the Bones by Sally Atkins. She's a professor of human development at a university in North Carolina. Tell me, she said, What is the story you are telling? What wild song is singing itself through you? Listen. In the silence between, there is music. In the spaces between, there is story. It is a song you are living now. It is the story of the place where you are. It contains the shapes of these old mountains, the green of the rhododendron leaves. It is happening right now in your breath, in your heartbeat, still drumming the deeper rhythm beneath your cracking words. It matters what you did this morning and last Saturday night and last year, not because you are important, but because you are in it and it is still moving. We are all in this story together. Listen. In the silence between, there is music. In the spaces between, there is story. Pay attention. We are listening each other into being. I love this poem. To me, it describes the process that happens in a support circle. Just wanted to share it with you. Take care. Bye-bye.